Our next two speakers will take us through a little bit of how the process of how Pay for Success projects are developed and share some examples of early childhood efforts at the state and local level. We'll first hear from Harvey Galloway, who is Executive Director of the BlueCross BlueShield of South Carolina Foundation. BlueCross BlueShield of South Carolina Foundation has a long history of support for evidence-based programs to improve the health of South Carolinians, and Harvey joins us today to share their role in the South Carolina Nurse-Family Partnership Pay for Success project.
Thank you, Catherine. Good afternoon and good morning to some of you. Appreciate Dr. Duggar's comments and Mr. Thorman's because they bring back a lot of thoughts about the processes that we did go through. So today, my goal is short. I want to give you a brief overview of how South Carolina came to adopt Pay for Success financing models with our intent to improve health outcomes in our state for the most vulnerable children and new low-income mothers, because I think a lot of times we think about the children, but the significant impact on these mothers has been really a great thing. I'm going to attempt to outline background, structure, metrics, and how all these pieces needed to align to facilitate the model to move forward. And let you know that it was not a short process. It's a process we began 8 years ago. And as I think about that 8 years ago, it brings back one of my favorite fables, the tortoise and the hare. And I feel like at times we were the hare jumping forward, and I feel like we were like the hare taking naps and waiting for the tortoise. And I feel like that the tortoise is where we ended up, going so slow, but yet winning the race. And even though there are different versions to the story, that's the one I'm going to stick with today. And I'm trying to change the slide. Catherine, do you want to do that for me?
Sure, we can. There you go.
Okay. The mission of the Blue Cross and Blue Shield of South Carolina Foundation is to promote and support healthier South Carolinians, particularly the economically vulnerable. We do that by addressing gaps in health care and serving as an agent of change to support innovations like Nurse-Family Partnership and bring value-added public-private partnerships to the state of South Carolina. Next, please. We have a number of investment strategies that we fund, and sometimes we don't get the right ones in the right categories, but this one we put in investing in South Carolina children, even though I think it really expands well beyond just investing in South Carolina children. But we have got a particular interest in investing in the children of South Carolina. Like many of you, we believe that the future of our state are the children. It's not as easy to teach old people like me how to change, but if we can teach young children changes, if we can teach young parents how to change, we can make a difference in the future. Next slide, please. As I mentioned, we began back in 2008 with the Nurse-Family Partnership Program. We were fortunate enough to be invited to the table by the Duke Endowment, and we have really appreciated the partnership that we've been able to build with the Duke Endowment and many of the other programs that are involved in what we're doing. Over the year, we've had many discussions with the National Service Office in Colorado about NFP model, how to increase efficiencies while also serving low-income first-time mothers statewide. Our challenge was that the model for Nurse-Family Partnership was built around larger cities, and we needed to find a way to deal with a predominantly rural state. And I can say that Nurse-Family Partnership has really come around and done a great job in doing that. And when you start thinking about nurse-family partnership, I get into a lot of discussion with people that really and truthfully do not know who they are. But they do a great job of pairing vulnerable first-time mothers with registered nurses who are given specialized training in maternal and child care. And, it is a specialized training that they need. In the state of South Carolina, we used hospitals as the delivering agency. We used the Department of Health and Environmental Control as a delivering agency. We used First Steps. We used a myriad of organizations to perform these home visits early in pregnancy up until the child's second birthday. And I start thinking about this, and you think about a new mom bringing a baby home from the hospital for the first time, and even if you're not living in an economically disadvantaged environment, it's a very difficult situation. And I've learned to appreciate what these nurses have been out there doing to help these moms get their life back together. And in a lot of cases, the moms didn't even have the support of anyone in the household. I used to visit with the nurses on a fairly regular basis, and you would hear stories about I had to meet the mother at the dollar store because she was living with her grandmother, and her grandmother said, I know how to raise a child. We don't need help from the outside. So there's a lot going on to get these programs that have good outcomes into these homes. And so that's what we've been trying to do. And the key to it is trying to figure out how do we continue it. Just like a lot of the other funders, our goal is to provide seed money to get the program started. The Nurse Family Partnership had community advisory boards, and one of their charges was to identify ways to continue funding of Nurse Family Partnership after the foundation walked away from them. Typically, it's a 3-year investment. During that 3-year period, we look for them to find ways to continue the programs that we've helped them start. We were not very successful with our community advisory boards. We had to continue as private, as philanthropy to keep these programs going until we could help develop a method of paying for them in the future. Next slide, please. And Mr. Thorman mentioned ICS, and ICS was, was extremely helpful. ICS is a separate partner of the BlueCross and BlueShield of South Carolina Foundation, and we use them to do other studies for us on child success in South Carolina and other programs that we fund. But the key to the study of finding out how to make pay for success is to look at who all of your partners are. In South Carolina, and I'm going to name them just to show you how many agencies were involved. You had the South Carolina Department of Health involved in it. You had South Carolina Health and Human Services. You had the Duke Endowment. You had Nurse Family Partnership. You had the Edna McConnell Foundation. You had the Boeing Foundation. You had First Steps. You had ICS. You had hospitals. You had individuals that stepped up and funded some of the programs. It shows you how many people in a rural state like South Carolina have to be involved to make these programs successful. The feasibility study that was done indicated that Nurse Family Partnership was viable as a home visiting model to be funded through a pay-for-success model. Well, we didn't know what a pay-for-success model was, so we spent a lot of time exploring pay-for-success. We were fortunate in that Health and Human Services in South Carolina was at the table because the majority of the mothers that enrolled in Nurse Family Partnership were Medicaid moms. NFP has evidence to result that shows us that there are positive outcomes to be had by enrolling in these programs. Outcomes that produce savings, as we've heard from to the government payers, in just general savings across the communities where these young people, the young pregnant moms are, and where these young children are going to go into school. There are significant savings there. Current NFP programs served only a small percentage of the number of first-time moms in low-income areas in South Carolina, and it has not been a large project by the scale that many of you work on. A total through 12/31/2015, starting back in 2008, show that 3,694 first-time moms were enrolled in the program. There were a number that dropped out for a myriad of reasons. Number one being they moved out of the service area where we had Nurse Family Partnership. They were forced out of it by family. The other reasons also came into play there. So we battled those issues in getting people enrolled and keeping people enrolled. And those were some of the challenges that we put out to each of the fiscal agents that were out in the field with these moms. How do you connect with them? How do you stay connected with them? South Carolina is not a big site, but the location of our nurses were sometimes 50 to 100 miles away from where the mom was in their service area. And they would drive and the mom didn't show up for the appointment. There were not a lot of cell phones in some of these homes for these individuals. Let's go to the next slide. And I guess this goes back to my statement about the number of people that are committed to it, because I think you need to know that the dollars that you're going to commit to it are large to get it implemented successfully. Now, Dr. Duggar talked about the return on investment, and we totally agree. In fact, I think the numbers are probably a little bit higher than what he shows on Nurse Family Partnership, but those are the official numbers, and those are the numbers that we use when we're out telling people about the advantages of the program. But from 2008 through the end of 2015, all of the investors in South Carolina have put $22 million into the program. For the next 5 years, the funders will put another $17 million into the program to see that the program goes well, that the program continues in the manner in which it's been established, that we've worked hard to dot all of the I's and cross all of the T's in every one of the service areas that we're in South Carolina. But we know that it's a challenge, but it does take a lot of people. It does take a lot of agreements. It takes a lot of documents to get these programs together. And one partner that I didn't mention was the Children's Trust of South Carolina, because the Children's Trust has been a great advocate of Nurse Family Partnership, and it's been a middle program in the fact that we ran all of the money for nurse-family partnership through the Children's Trust, and we're able to get McV matching dollars to do special projects within nurse-family partnership, and it had an absolutely fantastic relationship for there. Let's talk about some of the timelines. The Medicaid waiver that we needed for Pay for Success came in October of 2015. From October to March, it took us that long to get all of the contracts and to create a governance structure, to get the agreements in place, to get an evaluation plan that CMS would sign off on, that HHS agreed to, that will show the successes of the program. Remembering that all of the funds are going to go back to Medicaid in the state of South Carolina, and ultimately reducing costs in the state of South Carolina, medical costs. The pilot period was January to March of 2016 to test it. I'm happy to report that the initial results are great. So the official launch occurred on April the 6th, and as of May, we've exceeded our enrollment goals. We've exceeded our target capacity, and the target capacity was 4,000 individuals. We've exceeded our capacity for getting people enrolled in the programs. So a lot of good things are happening. A lot of money has gone into it, but we believe in that return on investment that we've had. So next slide, please. So we plan to continue this implementation. We plan to be with it through the next 5 years. We plan to work with all of the partners. We had monthly meetings with all of the partners to talk about the issues. Now we have an executive committee and an operations committee that reviews what's going on monthly from an operations, quarterly from an executive committee to determine that nurse-family partnership is moving in the right directions. If we were to identify areas that it was not going towards meeting the goals, we could obviously take action at that point in time to attempt to turn the boat, and that's what we are trying to do. Our biggest goal is further expansion. We recognize that by having 29 of the 46 counties in the state of South Carolina covered, we're not covering everyone. We are covering most of the high-cost zip codes in the state of South Carolina for children issues, but we want to expand it. Problem, finding the right types of organization in those counties that it's not already in to do it. But that is a goal. We want to continue to attack low-income zip codes, and we want to expand beyond the 29 counties as we're allowed to do it. Next slide. So let's get to the metrics a little bit of it, and they're pretty clear. Reducing the preterm birth rates is critical. Cost savings there, decreasing the hospitalization, emergency room use due to injury of children, and Dr. Duggar talked about that. Healthy spacing between births. And that was one of the most amazing things, to look at the second-term births that were second births in those families or in those households that were potentially averted. And I agree with his comment about the child abuse. Child abuse is a very bad situation in the state of South Carolina. We believe that this is extremely important. Increasing the number of first-time mothers served in lowest income communities. And Dr. Doug is exactly right. We don't have a measurement for it, but so in the $5.70, we're not including avoidance on child abuse. We're not including the information that's passed along to other moms from the first-time moms that are enrolled in nurse-family partnership. And the last slide, which is my email address, but let me go over a couple things real quick. South Carolina ranks 45th in overall child well-being. That is not good. That number encompasses well-being, economic well-being. It encompasses health, education, family, community relationships. We had to do something different to amplify, to improve the child well-being. We had to see health outcomes changing, and we believe that nurse-family partnership gives us a great investment that can translate into actual longer-term savings through the Medicaid funding. And all of the funders totally recognize that the funding results are coming back to Medicaid. We believe it's scalable. We believe through the Pay for Success model that it is totally sustainable. And when we sit down and we talk to Health and Human Services, they believe that it is totally sustainable with what the funders have been able to accomplish to date. We're pleased to partner in this shift of public and private efforts to help the underserved individuals in South Carolina. We believe that it will make a difference. We believe that there are many good things that we've seen happen in these 8 years. I won't tell you that some of the 8 years didn't create some frustrations. There were times that we felt like we needed to change the implementing agencies. We put some of them on probation when numbers were not being met and said, if you don't turn it around, you're going to have to leave the program. That was tough to do, but by taking that stance, we believe it made a difference. We believe every one of the agencies that are in the program in South Carolina believe in the results and want to see good results. With that, you've got my phone number, my email address. I'll be happy to take sidebar questions after this, and I'll certainly be available at the end of the presentations for discussion.